Hello, everybody. So my name is Aljosa Trmcic, but friends and everybody just calls me Al, which is perfectly fine with me. So I'm part of Cornell's dairy extension team, also part of Cornell's milk quality improvement team. And since March, I have also become part of newly established team, Cornell's Food Industry COVID-19 Emergency Task Force. So we are dedicated to helping food industry and consumers get through this pandemic. So I would like to thank the organizers for inviting me to give this talk, very interesting and challenging talk. The title is Testing During Pandemic, but as you probably expected, we will focus on COVID-19. Next slide. Yeah, okay. I wasn't sure, am I supposed to flip? Okay, thank you very much. So I put together this table, which is showing different pandemics and epidemics the US went through. So COVID-19 is something that we are currently in, and it's definitely affecting our everyday lives, but it's definitely not the only one. So we have, for example, experienced cholera pandemic that killed 5 to 10% population in big cities. So this one would be an example of bacterium like Vibrio cholera as a causative agent. We had problems with scarlet fever, second example, typhus as a third example of bacterium as a causative agent. The next one would be the biggest pandemic in history, 1918, the famous Spanish flu. So 700,000 deaths in US alone, 50 million deaths globally. They say that about 1/3 of the world population was infected at that time. Just as a note, so Spanish flu developed into what we know today as influenza A, so the common seasonal flu virus. And this common seasonal flu virus is still infecting a lot of people and actually also killing a lot of people. HIV pandemic, no need to explain this, we're still amongst the pandemic. We had SARS in 2003, we had swine flu, Ebola. Actually, Ebola is still around. We just had a big outbreak in Africa. There was about 100 infected people, about 50 people died. There was Zika virus in US in 2015. This is also something that's still around in the world. And then finally, COVID-19, more than 30 million cases, more than 1 million deaths, more than 200,000 in US alone. So I'm not going to go into too much detail about COVID-19 because I'm sure you listen about it every day. But next slide, yeah. If you are interested in any details about COVID-19, especially in relation to food industry, I would invite you to visit our COVID-19 webpage at Cornell's Institute for Food Safety webpage. So in this session, we will focus specifically on how food testing is affected by pandemic like COVID-19. Next slide. So the way I see it is there are 7 questions here that are kind of separated into 2 general parts. Number 1 would be, should I start testing for the agent that is causing the pandemic? And then number 2, should I change anything about the testing that I'm already doing? So more specifically, for this COVID-19 pandemic, should I test SARS-CoV-2 in my raw ingredients, in my finished product, in my processing environment? Should I test for the virus, my employees? And also, should I modify the testing I'm doing to assure food quality? Should I modify the testing I'm doing to assure food safety as a result of pandemic? So let's start with the first 2. Next slide. So I hope we all agree that kind of raw ingredients and finished products from a lab testing perspective fall into a similar category. You know, someone's finished product is somebody else's ingredient. And I guess the plan for one would probably be very similar as for the other one, whatever the decision is, you know, testing or not testing. So the question, should we test our raw material and finished product for the agent that's causing the pandemic. Next slide. So obviously, some people would say yes. You probably remember the reports about SARS-CoV positive cutting board that was used for filleting salmon. There were actually 40 positive tests of employees and environment in that market. But this specific cutting board was said that it could only be contaminated by a contaminated salmon. So this was in June this year. Next slide. A month later, at the International Association for Food Protection meeting, Jianxi Chen from China National Center for Food Safety Risk Assessment reported that there were actually several samples of seafood and meat that were RNA positive for the virus. And they say two possible transmission pathways were possible. One is food, and the other is person to person. So at the time, they said that the investigation is still ongoing, but they already kind of partly implied that person to person is less likely because the virus isolated from the cases in that local area were different RNA type than the rest of the viruses that they found in Beijing. So China continues to test imported food, focusing on produce, on seafood, on meat. And I'm sure you've also heard of chicken wings from Brazil and shrimps from Ecuador. I think there were about like 7 reports about positive seafood products and other products. So the question is, should we do the same? Should we test our raw ingredients and finished product for SARS-CoV-2? Next slide. I would say no. So since the title is pandemic as a general, maybe one day we will have to test our raw material and finished product. So if we look at history, there were some bacterial pandemics that can be or were maybe partially foodborne, but for now, for this COVID-19 situation, it would definitely be no. Next slide. So based on this Chinese testing of those Brazilian chicken wings and having them presumably positive, Philippines actually banned imports of chicken from Brazil. So my thought when I saw this was if the company that produced that implicated product was testing the product for SARS-CoV-2, they would not be in this situation. But as you all know, no testing can assure absolute absence. Whatever positive product China found, it would be hard to prove that it was not positive. And especially if you don't have any details about what was tested and how it was tested. Next slide. So I guess our opinion stays the same. You should absolutely not test your ingredients or finished product for SARS-CoV-2. Next slide. So why am I saying absolutely not? Well, because SARS-CoV-2 is absolutely not a foodborne virus. If you think about it, there are some other types of coronavirus that are maybe responsible for common cold. And we definitely don't go around being afraid we will catch common cold from food. And the same should be for COVID-19. So if I go back to the cutting board and the salmon and the chicken wings, so Chinese authorities, after they identified that positive chicken wing sample, they traced it back and they tested additional samples from the same lot, samples from associated shipments. They even tested people that got into contact with the positive samples. And they actually didn't find any positive samples or positive cases. So I know that this is not evidence that the virus is not foodborne, but after all this time and more than 30 million cases globally, we would expect to see at least some evidence if the virus was foodborne. Basically, it's impossible to prove that something doesn't exist. So in order to do that, you would have to test all the food that's out there. So what we can say is that after 30 million cases, we can say with high confidence that the food is not a risk. And another aspect that supports this, if we go to the next slide, is basically the science. So the scientific reasoning behind SARS-CoV-2, why it's not foodborne virus. We already mentioned the common cold, and none of the other coronaviruses are foodborne. SARS-CoV-2 and all other coronaviruses are enveloped viruses. This means that they have this fat layer on the surface that is very sensitive to environmental conditions. Currently, we don't have a single example of enveloped virus with this fat layer that would be considered a foodborne virus. So norovirus is not an enveloped virus. Hepatitis is not an enveloped virus. All foodborne viruses are non-enveloped, which means they don't have this fat layer. They only have this protein part of the coat, which is much more stable in the environment. So we say SARS-CoV-2 is less stable outside of the host, which results in short half-life. If you look at some of the studies, they showed that the half-life for this virus is 1 hour, 3 hours, 7 hours. It all depends, on the media, on the surface, on the environmental conditions, experimental conditions. But whatever it is, the half-life is short. For example, if you look at virus like hepatitis A, the half-life would be measured in days. So much, much longer. And this is also consistent with recommendations from CDC and other agencies that say contaminated surfaces are not a major mode of transmission, just because the virus does not survive outside of the host and in the environment for long. Okay, next slide. So we said that testing for raw material and finished product for the virus would not be reasonable, but what about testing our environment? Next slide. Should we swab our environment and surfaces and see if it's contaminated with the agent that's causing the pandemic? Next slide. Again, so if we were dealing with a different pathogens, maybe one day, but in this COVID-19 situation, I would definitely say no. And so why? Because we just covered that. So COVID-19 is sensitive outside of the host, sensitive in the environment. And even if the surfaces are contaminated with the virus, they would not stay contaminated with a viable virus for very long. Next slide. So talking about viable virus, another aspect that would have to be addressed in order to test the environment is how to test. It is very hard and expensive to test for viable virus. And even if we did, test for viable virus, once you, swab, you test, you get the results and do something about it, the viable virus would be already inactivated and long gone. So to test and get a quick result, you would use RNA tests that we see being used every day in different applications. So it shows quickly the presence of viral RNA. And of course, RNA is far from a viable virus. So when you are testing, for example, RNA in humans, the classical virus test, at least based on the concentration of that RNA, you can say something about the active replication of the virus and the stage of infections. On surfaces, RNA quantity can be related to any presence of viable virus. So even if you get a positive result, you don't know if this is residual RNA from viable virus or inactivated virus. Next slide. So now that you know that the test is not detecting viable virus, it is testing for RNA that can be there for quite some time, I ask you, would you test the environment? Is there anything informative about presence of viral RNA in your processing environment that you would find useful? I'm gonna, through this presentation, I'm gonna ask a lot of questions that are more rhetorical, but we have a panel discussion afterwards, so it's just something to get you going. Next slide. So around April, when it all began, I made this attempt to develop a useful infographic. I called it the 12 circles of protecting food employees and the food production. So I know, very poetic, but this is basically how I see it. Next slide. So yeah, I don't expect you to read the fine print. I'm just gonna go through it. So basically, we have our production facility in the center in the blue, and inside we have all the employees, and we have a lot of COVID-19 virus outside in white. And in order to maximize the protection of employees and the production, we have to do, step one, prevent employees from getting infected in the community. So this would be all of the education and support, and overall having a good relationship with your employees. Next slide. In the step two, you have to prevent employees that do get infected in the community from entering your processing facility. So that will be all the screening, self-assessments, and checks that you and employees can do before employees enter the facility. Next slide. Step three would be prevent infected employees that do enter your facility from directly infecting other employees. So that would be preventing that person-to-person contact, all the social distancing and face coverings that we are talking about. Next slide. And then the final step, prevent infected employees that do enter your facility from indirectly infecting other employees. So that will be all the contaminated, frequently touched surfaces. So now if you're doing a good job in the first two steps, so not getting infected in the community and doing a good job with screening before entering, technically you should not, you should have zero viable virus in your facility, and you should also have zero viral RNA in your facility. So if you do decide to do the environmental sampling for the virus, the only benefit that I see is if you did a validation, for example, of your screening methods and your educational material. So all the things that result in employees staying home when they are sick. Or maybe you can, validate your overall relationship with your employees. So all the things that result in employees actually telling you when they have symptoms and not hiding it from you. Next slide. So maybe we can make this hard no as maybe if you want to do validation. Next slide. I have another maybe. So maybe you could do environmental sampling for the virus because your employees would want you to do environmental sampling for the virus. Here I have another rhetorical question for you. Next slide, yeah. So what is a good worker? A good worker is actually a worker that actually comes to work, yeah? The next slide. So in order for the worker to come to work, they have to know that they are safe. They have to know that they will not get infected at work. They have to know that when they go home, they will not infect their family. And finally, if they do get infected, employees have to know that employer will be there to take care of them. And this includes, taking care of their physical, mental, and financial needs. And even though companies might be doing everything to protect their employees, these employees might feel like there is more than the company could do. So companies might sometimes consider not just keeping the employees actually safe, but they can also invest some energy into making sure they also feel safe. Yeah? Next slide. So if you think about that, although we know that environmental testing for SARS-CoV-2 is not useful for reducing or mitigation of direct risk to the employees in production, this environmental testing can show employees that the company does care and is doing everything to protect them, and this perceived sense of security can have a positive effect on the work spirit in the production and the overall production itself. Next slide. Yeah, so before I move on, there's a disclaimer to this doing environmental sampling to show employees that they are safe. So this medicine is only effective after the actual safety of employees is established. So it is important to have all strategies that are actually protecting employees, like social distancing, face coverings, and hand washing in place before you decide to implement a program like this. So talking about basic prevention strategies and making sure employees feel safe, there is also the other side of the coin, of employees feeling safe. For example, when people feel safe, they tend to drop their guard and maybe not follow the basic prevention strategies like social distancing and face coverings. So this is all kind of things you have to keep in mind when you're making your plans. But the general idea is, so you lose a couple of $100 on the environmental sampling that does not give you a lot of useful information, but you keep an uninterrupted production that is worth maybe thousands and thousands of dollars. And if you look at this like this, maybe environmental sampling might be a good investment if you have people that are actually afraid of working. And hearing about all the meat processing plants, it makes sense that some people are just afraid to work in food processing facilities. Okay, so next would be employees. Should we test our employees for the virus? Next slide. So the answer is yes, but you should not go about just randomly testing your employees, but you should have first, a good plan, a good program for testing employees. And the type of program depends on number of different factors that each company should evaluate, by themselves, and then tailor the final program to their needs based on the risk in their area and their facility. I listed some of the questions that you could consider is, of course, when you have a case among your employees, when employee has been in close contact with a COVID-19 positive person, when employee works with maybe a medical worker that actually works with COVID-19 patients, when employee comes back from out of town or out of state travel, when coming back from a medical procedure, even if it's not COVID-19 related, when employees are or work with someone who is in higher risk of developing a severe illness. And the final one, next slide, I highlighted. So can we go to the next slide? So the last one would be very important. You need to follow the cases in the community. And you use that information to respond to any elevated risk, with modified or enhanced screening, including testing. Next slide. So this is why on our COVID-19 webpage, there is a whole section dedicated to COVID-19 trackers and predictive mathematical models. So there are trackers on a global scale. You have trackers for US, individual states, cities, counties. Next slide. Just as an example, Cornell is in Tompkins County, New York. We had some positives, but considering that the schools reopened and that the testing number went up, the increased numbers I think are still okay. I'm really happy Cornell is doing a really good job at protecting the students, the staff, the faculty. But of course, you never know, and you have to keep following those numbers. Next slide. So before we move on, I want to talk about when you have a case among your employees. Next slide. So because employees, so all employees are very valuable in overall, food processing operation and keeping uninterrupted food supply during this type of crisis. So CDC and FDA allowed in their guidance for a person that had a close contact with a positive individual to remain working if they don't, show symptoms, and other additional precautions are strictly followed. So this is something that's allowed, but by no means is this something that's recommended. So if you can work without that person, I would definitely send them home. And another thing to also check is with your local Department of Health or even inspection agency, if this is even allowed. But in any case, if you decide to go that route of keeping close contacts working if they don't have symptoms, testing might be a really good idea in this situation. For example, having them on a regular schedule for testing during those 14 days that usually an infected person needs to develop the symptoms, or develop sufficient high number of virus in the system to be detected by a virus test. Next slide. So talking about people that have sufficiently high number of virus in the system, but are not showing symptoms, like pre-symptomatic and asymptomatic people, if you look at some of the CDC documents, they say that when symptomatic workers with COVID-19 are identified, there are often asymptomatic and pre-symptomatic workers with this SARS-CoV-2 present in the workplace. So this is another good information in support of doing some expanded testing of your employees when you have a positive or a symptomatic person in your facility. Next slide. Okay, so since this is a testing or a lab session, we have to mention all of the different options we have for testing employees. So we have tests that are used to determine current infections. So this would be diagnostic tests and virus tests. And we have tests that are used to determine past infections. So that would be the antibody tests and serological tests. The diagnostic tests are usually performed on nasal or throat swabs, but some of the recent tests are also designed for the test sample of saliva that people spit in a container. These tests usually target viral RNA, but there are also antigen tests that target specific viral proteins. So RNA tests are more accurate, but usually take longer to be performed and analyzed. Antigen tests are simpler and quicker, but less accurate. And depending on how you're going to use that result and information, you might have to go back and confirm the results with a RNA test. So both RNA and antigen tests can detect these molecules from a virus that actually is not active or infectious. However, because both tests have this quantitative capability, so we can use this information to assume, based on previous research, if the RNA or antigen is coming from an actively replicating virus or not. There's also a third method, we already talked about it, which is usually used in research, and this is testing for actual infectious virus. The way you do it is looking into how many mammalian cells in a culture are killed by a viral sample. So this method is definitely complicated, it takes long, and it takes a lot of money to be performed. So just to give a comparison of this test versus the viral test, usually an infected person will shed an infectious virus that can be detected with the test for viable virus for up to 10 days after they develop symptoms. If you look at RNA, on the other hand, can be detected with the RNA test for up to 90 days after they develop symptoms. So the quantity of RNA is substantially reduced once the person is no longer shedding detectable levels of infectious virus. But because the method is so sensitive, you can detect the presence of RNA for a really long time. What about the antibody tests and serological tests that we talked about? We said that these tests will give you information about any past infections because they target antibodies which are formed and appear in blood 1 to 3 weeks after you develop symptoms. So our body forms different kinds of antibodies. Usually IgM would appear first, then you have IgG. Tests can test for one, other, or both. But the important part is that in this situation, for what we are looking for, these tests would not be appropriate to test employees, because we are really interested in who's infected at this very moment. There are tests that these tests actually are tested different research groups, at universities, health departments, CDC, might use to see, the general spread of the virus in the population, in the community. If I would, think about a situation where antibody tests would be used in processing facility, it would be again to kind of validate your control strategies or identify near misses. Technically, if you have everything in place and everything is under control, you should be able to tell who is supposed to test positive for antibodies. So that would be previous cases, of course. If you have other people that test positive, it might be that they slipped your screening process. But again, if they didn't infect other people in the plant, this might mean that all of your other prevention strategies like social distancing, face coverings, hand washing, are effective and in place. So infected person entered the facility, but they didn't infect other people, which is also good. Another part I wanted to mention is that antibodies are there, of course, to protect us from the next viral infection. But when it comes to COVID-19, how long the antibodies remain in the system and how much protection and immunity we get from them is not completely clear. So any antibody test or previous infection should not be interpreted as protection from the next infection. Okay, next slide. So with this, we finished this first part of questions that are about testing for the agent that causes the pandemic. And now we are moving to questions about testing that we are normally doing in food industry or that we can do, like pathogen testing, environmental monitoring, chemical residues testing, and see if we should, modify any testing that we do as a result of pandemic. So the first one is, should we modify the testing of our raw ingredients as a result of pandemic? Next slide. In general, I would say yes. We have been reading about disruptions to the food supply chain, problems with labor, inspections being postponed, third-party audits being delayed, and so on. So it's likely that the quality and safety of raw materials is going down. I think that's a fair statement. And with this, the risk is going up. So increased testing can definitely lower the risk. But however, it definitely depends, so you have to look at, who is your supplier, where are your supplies coming from? For example, were you forced to replace or add a supplier because of the pandemic? Do you know how COVID-19 is affecting your suppliers? Is the state where your supplier is coming from a major hotspot for COVID-19? Are they constantly in the news because of the cases? Was the supplier forced to, switch from air transport to boat transport? How long are your ingredients in transit? All these things kind of have to be weighed in. Next slide. I have an example here. So, for example, you're getting your spices from Brazil. And this doesn't even have to be, a supplier from Brazil. It can be US supplier that's getting the spices from Brazil, or they had to switch because of the pandemic. So Brazil, we know, is still very much considered a hotspot for COVID-19. And there's no doubt that production and processing and transport are affected by it. So again, inspections are limited, third-party audits are limited, supplies are limited, workforce is limited. And this is all increasing the risk for us. So not specifically COVID-19, but everything else that's associated with food quality and food safety. So if you were getting your spices from Brazil before the pandemic and you determined that you need a certain level of salmonella testing to reduce the risk to acceptable level, during pandemic, because the risk of salmonella is increased, you have to do even more testing to reduce the risk to the same acceptable level. Next slide. So yeah, talking about spices, guess what food item is very commonly sold as something else or not 100% what it should be? Spices. So food fraud. Another food safety aspect that is on the rise because of the pandemic is food fraud. So food companies are really very occupied with securing enough food or getting any ingredients to keep the production running, and can forget to make sure that they are getting as an ingredient something that's right, or even more that it's safe. So people and companies are definitely taking advantage of this situation, and experts have been warning about food fraud since the start of this pandemic. So food fraud is definitely something another reason why the testing should stay essential or even be increased to reduce the risk. Now, maybe the question is, can this be done in-house, or do you need to outsource your testing? Because oftentimes, more specialized methods and equipment are needed to determine authenticity and safety of your food, especially if we're talking about chemical food safety. With this outsourcing, maybe a comment, if you are outsourcing your testing, then it's very likely that other companies are also outsourcing, and there's just so much samples that a private lab can process at certain time. So who are your partners in testing? Make sure you establish those relationships before the crisis, so when the crisis comes and you need help, you have somebody that will step in. And this goes beyond just lab. It goes, for the suppliers and actually your customers. Next slide. So we said that testing, material coming in might not be sufficient during pandemic just because of the supply chain and other disruptions that producers, raw ingredient manufacturers, and distributors are going through. So now I ask you, what about you? Are you experiencing any disruptions? Is your product more or less likely to have a problem now compared to the product that you were sending to the market before the pandemic? So should you increase, testing of your finished product? Definitely something to think about. So the question, should you increase or not increase the testing, is kind of similar with the questions we talked about for the raw ingredients coming in. But you can definitely have better answers. You can have, you can more fine tune your decisions when it comes to your own product. So if you can make sure the ingredients and everything else coming in is okay, and everything within the processing plan is under control, you basically have control. But I will ask you another question, how many of your QAs and QCs were converted to COVID-19 control people overnight? Do you have the same control over what's going on in the processing plant during pandemic as you had before pandemic? Or is, some of that control lost to finding, sufficient number of face coverings, finding somebody that will wash and sanitize your face coverings, maintaining a proper screening? So if the answer is no, control is not the same, and yes, some of the control is lost to COVID-19, then maybe increased testing is in place. Next slide. Okay, so the last part, environmental monitoring. Next slide. I'm happy that at least one point in one question, I can give you a definitive answer, and this is yes, you should modify your environmental monitoring, and I will tell you why. So next slide. If you look at all the general guidelines for food industry, for example, FDA, CDC, these are kind of the instructions that you will find. Next slide. So they ask us to reduce the number of employees working in the processing plant at any given time. So something that used to take you one shift now should be stretched over 2 or 3 shifts. It's still recommended that 1 shift is reserved for your sanitation crew, but the workflow has definitely changed, and other things might have changed with it too. Next slide. Another way to keep people 6 feet apart without reducing the speed of your assembly line is to extend the assembly line, which is reducing the space, increasing the number of objects, increasing the number of surfaces in the production area. Next slide. When you are not able to keep employees 6 feet apart, they say you should install barriers, dividers to separate them. Again, introducing new surfaces, and some of these are potentially right above the exposed food. Next slide. So the entire flow of how people are moving is being modified. There is now maybe just one entrance, but more people are entering through that entrance, elevating the risk of bringing a pathogen at that specific point. Other, for example, entrances are now just exits, and maybe the risk at those points is going down. Next slide. We are asked to put markings on the floor. We're asked to put posters and teleprompters on the wall, which is all bringing complexity to the cleaning and introducing new surfaces, potential spots where pathogens can hide. Next slide. They say get a tent. And so we are introducing new areas as part of the processing facility, and we are modifying the existing areas. Next slide. Employees. So employees are more likely to stay home, even if they are, if they are not COVID-19 positives. And new employees, it's hard to get. The ones you do get are often less experienced and can go through this, expedited training. Next slide. So because of all these changes, it would be probably strongly recommended to reevaluate, modify, and update your environmental monitoring plan. And if necessary, which I think is most likely, enhance your environmental monitoring. I will tell you that some of the processing facilities have definitely decided to do that, because our PFG work for some of the clients has gone really out the roof during this pandemic. And it definitely makes sense because of all the changes that we were forced to introduce in order to stay in production. Next slide. Yeah, so with this, I'm gonna slowly finish. Maybe just a quick overview of what we talked about. So the 7 questions. Should we test for the agent that causes pandemic? We said that raw ingredients, no. Finished product, also no. Testing of processing environment, maybe, but not to directly protect employees or the consumer. Next with the testing employees, it's very much recommended, but you have to have a good plan. So who to test, when to test, how to test. You also should know, how you will react to the test and how you will manage the results. And you should know all that before you start testing. Next, should you modify your existing testing? It's okay. Like raw ingredients, finished product, we said maybe or most likely. Environmental monitoring, absolutely you should modify. So yeah, with this, next slide, I'm gonna say thank you very much. I found this graffiti COVID was here in April. I'm still waiting for us to talk about COVID-19 in past tense, but we are definitely not there yet. Yeah, I look pretty good before this pandemic in April, and obviously you can see that this 6 months of this pandemic has not been kind to me, and I'm sure to all of you. So thank you very much.